All right, everybody, how's it going? Everybody doing good?
Hi, Professor.
Hi, nice to see you all. Wonderful, happy faces. All right, so we have quiz one. Is everybody ready? I know. Oh no, not a quiz. It's gonna be okay. You guys are gonna be fine. You're gonna do great. Um, let's see. I just had it open and I'm like, oh, I lost it. All right. So I am going to put the password out. Hold on, I just got attacked by my cat. Put the password in the chat. And so you guys have, it's 10 questions. You have 15 minutes to take your quiz. When you are done with your quiz, go ahead and turn your cameras off. So I know that you're done, and then we will get started for the evening. Sound like a plan? All right, good luck.
Okay, release. Recording in progress. Okay. Professor, I don't have the access code. I was just able to get in.
Good job, everybody. Are y'all getting kicked out and then having to come back in?
So my internet had actually stopped working about 10 minutes before class had started, and we tried restarting it. I'm actually currently using my husband's hotspot on his phone.
Oh, wow. Okay. Okay. I was like, I've never seen any of that. People have to keep getting kicked out.
No, they usually we have to take the tests and stuff like with our phones, and then when
Hmm.
we're done with the quizzes, we'll turn our like log out with our phone and log back in with the computer.
Okay, gotcha. Like, gotcha. No worries. All right, so how do you guys feel about your first quiz? As I sit here and choke, it's gonna be okay.
It
Yeah.
was not fun.
Am I- All right, so let's see. Let's look at it real quick. All right, so what's community-based nursing? What are some things that we would do for community-based nursing? So you had review policy and procedures, review outcomes of clinical trials, review several nursing textbooks, review reputable sites on the internet. Which of those best describes what community nursing is?
I guess the outcomes of the clinical trials.
Yeah.
Outcomes of the clinical trials.
I didn't
Absolutely.
choose.
Okay, so math question. You had an order to administer heparin 850 units per hour via IV infusion. The medication comes mixed comes mixed from pharmacy as heparin 25,000 units in 500 mLs. How many mLs per hour would you be setting the pump?
17. And I moved too fast and didn't put that 7.
Oh no. Okay. So who uses dimensional analysis? Okay. Oh, hold on, I got somebody else waiting.
I was about to say, sorry, Miss Martinez. Shanisha texted me to let you know that she was waiting for you.
I see it now. I'm working on it.
Hannah needs let back into, she said.
Yep.
Sorry, okay.
Got it. Sorry, I'm like going off of two screens and I didn't see that pop up. So, all right. So who likes math? No, wait a minute, only one person likes
I'm the only one. I love math.
I do too.
Yeah.
I do too. It's something that, you will carry with you for the rest of your nursing career. So getting comfortable with those dosage calculations is like crazy important. And so I love math, so I will leave that at that. If you guys if anybody needs help with math, please let me know. Like I said, I love math. I can do, I teach dimensional analysis, I teach the formula based. So usually whatever works for you. But just let me know, okay? And we can work on some math. I love it. Okay, so what we like lost my place. All right, so which of the following is a primary focus of public health nurses or public health nursing? So you had families and groups, healthcare of communities and populations, illness-oriented care, individuals within the family unit. So who's the primary focus of public health?
Communities and populations.
Communities and populations, right? That's exactly what we're working with. Which of the following interventions would the nurse most likely implement within addressing the problem of asthma among school-aged children? All right, so this was the select all that apply. So we had assess schools and daycare centers for environmental friendliness. Teach all school personnel how to use rescue inhalers, share nutritional information with all students in the school. Oh, and then the last one was develop home and environmental assessment guides. So the answers were assess schools and daycare centers for environmental friendliness and develop home and environmental assessment guides. So a lot of people chose teach all school personnel how to use rescue inhalers. Why do we think that that would not be an appropriate answer?
Is that probably maybe because the schools would have a school nurse, maybe? I don't know.
So they,
Because this is all-
okay, so yeah, so the nurse, right? The nurse, all school personnel shouldn't be taught to use rescue inhalers. As nurses, right, that's part of clinical judgment, right? How do you, we generally speaking, teaching them how to use the inhaler isn't going to be affected. And it brings me back a long time ago. I have a pediatric background as well, so I love pediatrics. And I interviewed to be a school nurse, and I thought this was a really interesting question, and I don't know the background behind the question, although I really wanted to ask, but the school principal has, I think he had a PhD, or he had a doctorate in probably, education or something along those lines. But the lady that did my interview, she asked me if the principal, who was a doctor, but not a medical doctor, told me to administer a medication to a child, is that appropriate?
I'm sorry, can you repeat that?
Sure. So if a doctor who is not a medical doctor tells you to administer a medication, is that appropriate?
No.
No.
No. Right. And so I just thought that was a really interesting question to be asked. It makes you wonder what what the context was behind that and who had done that, right? Even school nurses, they're responsible for the welfare, the well-being of the children that they are taking care of, but they just can't administer medications, right? There has to be orders and other things that are in place in order for that to happen. A nurse is explaining the healthcare system in the US to a group of healthcare providers visiting from South America. How would the nurse best describe the current healthcare system? So it's divided primarily into two components, private and public healthcare. Your next option was, it is the best in the world with outstanding research and high technology care available to all. It is a logical, rational approach to meeting expressed needs while still trying to control costs. Or D, it is a centralized system that provides care in hospitals. So what's
It's
the
divided
two
into two
components.
parts.
Very good. It's divided into two components, private healthcare and public healthcare. A community health nurse is determining the best way to address an outbreak of a new infectious disease using evidence-based practice. Which of the following actions would the nurse most likely take?
Este es un problema entre Arturo y yo y lo vamos a resolver nosotros. Ya te lo había dicho.
So, review policy and procedures, review outcomes of clinical trials, review reputable sites on the internet, or review several nursing textbooks. How are we addressing an outbreak with evidence-based practice? Which one of those is going to give you the best?
What was the options again?
Sure. Review policy and procedures, review outcomes of clinical trials, review reputable sites on the internet, or review several nursing textbooks.
Outcomes and clinical trials.
Outcomes of clinical trials. Which of the following statements best explains why family functions and structures create unique challenges in family nursing? Functions and structures do not apply to all family units. Function and structure change over time. Traditional families are rare in society, and some clients do not have families.
Structure, change over time.
Right. Which of the following best describes the use of genomic healthcare? Assist with understanding family relationships, useful in learning about environmental risk factors, assist with determining familial health risks, or useful in detecting risk for developing cancer.
Familial health risks.
Yes, correct. Familial health risks. An elderly person is in the last stages of dying. Which type of care would be the best for him? So your hospice, your nursing home,
Hospice.
health, hospice. And then which of the following activities are included in the Centers for Disease Control and Prevention School Health Program? So we have providing mental health counseling, ensuring a healthy school environment, giving immunizations to students, staff, teachers, and their families, assisting teachers with education related to health, and encouraging nutritious school meals. Which of those are part of the CDC's school health program?
Ensuring a healthy school environment.
Very
Why wouldn't encouraging nutrition be one?
I'm sorry.
Why wouldn't encouraging nutritious meals be one?
When we look at nutritious meals, we do have that's a separate part of it. So they look at other options. So when we're looking at we do encourage schools, or we encourage students, right, to eat nutritious. They would do like nutritional education maybe for the students, just talking about healthy diets and healthy living and things like that. But encouraging the nutritious school meals is something that is going to be set up by a different government agency.
Okay.
And they don't give immunizations to the students, the staff, things like that, within the school systems. So it is a little bit different when you look at like hospital organizations, right? If you work for a hospital, they have things like, occupational health, where there may be somebody that could give their flu injections, and stuff like that. But generally speaking, there's not going to be, they're not going to be the ones that are, giving those immunizations and things like that. They would have to get that outside within, their own providers or something like that. I mean, so you guys did really well, for your first quiz. Did everybody do the readings that were assigned for this week?
No.
No. Okay, honesty is always the best policy, right? And so we do have an activity that we are going to work on. I'm getting ready to put you into some groups. And I will give you, each group is going to have a different scenario. Then so give you 20-25 minutes to work on your scenario. And then we will come back together. I'm just trying to get your room set up. And then we will come back together. Everybody needs to participate. And each person will present part of, what we are, part of what is just trying. Okay, I got everybody in a room. So you'll work together. Sorry, lost my train of thought. I'm going to put you in a breakout room, going to give you a scenario. You will all work together. Everybody needs to participate in the scenario. When we come back together, you can do it one of two ways. Some people are a little more vocal than others, and I understand that. You can have one particular spokesperson, or you can have everybody in the group participate and present part of the scenario to the group. Again, each group is going to have their own scenario, so it's going to be a little bit different, but it is based off the concepts that you would have had in your reading for this week. Any questions so far? Nope. All right. So let's see. Did everybody look at the group assignment or the groups for your assignment for your
Yes.
groups for your group assignment? Okay. And does anybody have any questions about that?
Not really. It's just, do we just submit it? Like, it look like a discussion when you click on the.
Correct. There's going to be, I'm gonna put you, I'm trying to think of the best thing that I saw you. 1, 2. Yeah, so there's going to be a Dropbox for you to submit your assignments. So you'll submit it through the Dropbox.
Okay.
Also remember when we're doing group projects that everybody needs to participate and make sure that they are, doing what you need to do as part of that group project. If there's any issues with that, please let me know, and we will go from there. Okay? All right, so I have your group set up. I'm going to go ahead and put you in your breakout rooms. So you will be moving, just to let you know. Just waiting on a couple more. All right, well, welcome back. Who would like to go first? I know, there's the question.
Don't all speak at once.
Don't all speak at once, exactly. We can just go down the list. We'll start with group 1.
That's fine.
All right.
Okay, what group are we, Professor? I was just in the group. I don't know what number group we were.
I think we were 3.
We were group 3? Okay. Okay.
All right, so group 1, tell us a little bit about your scenario and
So our
Okay.
scenario is a nurse at a local hospital. She's noticing a trend of a certain age group coming in hospitalized with complications of uncontrolled type 2 diabetes. She notices mainly among people of color and 2 Caucasians. And so our questions are regarding, what are some like risk factors? What can we do? Some informational things that we could address. So our first question is, what about risk factors concerns you most as a community nurse? So some risk factors are cultural and socioeconomic barriers. Certain cultural groups and populations have limited access to health education, which can lead to poor understanding and management of the disease. And certain population ethnic groups are also disproportionately affected by diabetes due to genetics, environmental, and lifestyle factors. Question 2 is regarding primary, secondary, and tertiary prevention. Here we did primary being educational programs for the community, secondary being routine blood sugar monitoring and education, tertiary being comprehensive diabetes management plans. Unfortunately, we couldn't get to question number 3. Question number 4, how would you proactively bring this concern and information trends of DM, diabetes mellitus, in the community to be addressed? It was said to be, as a community nurse, to bring awareness to the matter of the rising trends of DM. I would create informational pamphlets and host informational seminars to address the rise of how to prevent it. And lastly, how important is culturally competency given the population you have in your care? It was said to have a better understanding of different cultures and the importance of certain foods, such as African culture is rich in starch and carbohydrates, whereas Indian culture is rich in spices and curry. As a community nurse, being able to have a better understanding of someone's culture and how much of an influence that has on a patient can directly affect the outcome and how well a patient sticks to the treatment plan.
Okay. All right. So you had a group that was very diverse, right? So you had a little bit of, you had Latinos, you had African Americans, your Filipinos. And diet is a big issue with that, as well as genetics when we look at certain diseases within those populations, right? And so you didn't look at the healthy people 2030, and that's okay. I understand, because there was really kind of a short amount of time in order to do that. Has anybody looked at the healthy people 2030 websites yet? Okay, so what are some of the biggest risk factors for type 2 diabetes?
Obesity,
Obesity. Okay, what else?
hypercholesterolemia,
Hypertension.
hypertension,
Hypertension.
Lifestyle.
Lifestyle. Okay,
Mhm.
so diabetes, lifestyle, family history has something to do
Yep.
with it, genetics as well.
Poor diet.
Diet. So when we look at communities, all right, when we look at what's going on in society, This is, this age group is 25 to 35, so they're fairly young, right? What in society, other than the diet, the exercise, what else in society helps to increase the risk for type 2 diabetes?
Like their socioeconomic status.
Okay, socioeconomic status. What else?
Alcohol consumption.
Alcohol consumption. What about fast foods?
I was just gonna say the convenience of it.
The convenience of fast foods, right? So I popped into one of y'all's groups and we were talking about like epidemiologists, right, within the health department. So our epidemiologist here at the health department did a study with in the downtown area. Our area here is huge. So our health department covers it's like 7 cities and 2 counties. So she's got a very large area. In our downtown area, we had a very high rate of the development of type 2 diabetes as well as obesity in that one area. And so when you look at and this was, this was done a little while ago, and it's not changed a whole lot since her study was published. A lot of it was public housing. Okay. So we had a large majority of people living in public or government funded housing. There was a very high crime rate in the area, limited public transportation. And this is a city that, not like, I'm from New York, right? So I'm used to big cities, but here, it still would be considered the city. Limited public transportation. Okay, the grocery store. So we have like Farm Fresh, or Food Lion. I'm not sure what grocery stores are in your areas, right? They all shut down. So within a 5-mile radius, there was not a grocery store that someone could go to. So you take all of those factors, and they had a bunch of there was a 7-Eleven, there was a couple of little, I guess mom and pop stores, where, kind of like a little small convenience store where you're going to find canned goods, maybe some frozen dinners, that kind of thing. Right. So if I have low income, I don't have access to public transportation or my own private transportation, and I don't have access to a grocery store, right? What am I going to feed my kids? What am I going to feed myself? Right? Going to the convenience store in the corner, I'm getting, junky food, right? I'm getting canned foods, I'm getting frozen foods that don't have the best nutritional value. So those are increasing the rates for obesity, which then increases the rates for, the development of type 2 diabetes. What about some of the other things that we see in some of those areas, right, with the high crime rate and the violence? Do you want your kids outside running around and playing and, riding their bicycles or whatever it is? And if we know that there's a lot of crime in that area, right? Because that puts our kids at risk. So that decrease their physical exercise. So we have to take that community as a whole and look at everything that's going on with that community to identify some of those risks. Can we fix everything? We wish, right? Wish we can wave a magic wand and fix society and make it safe for all of our kids as well as adults. But it's other things that we can, look at to try to, make those communities a little bit safer. And education is key, right? And just like if I don't have a car and I don't have public transportation to get to a grocery store, right? What is my access to healthcare? Right. And so we know that there's billions of people, or millions, they're not billions, but lots of people out there that don't have access to healthcare, that don't have primary care providers, that don't have appropriate health insurance. Right. So are they getting their preventative measures done? Right? Are they going in for screenings? Are they going in for their physicals? Are they getting their immunizations? Right? These are all things that we have to look at as a community level. And then what can we do as nurses to go out and help, Any of you like follow like or know what's going on with your like public health departments in your area, like their immunization clinics. We have like our health department has an immunization clinic. Now, granted, you know, not every immunization is free. In some cases, they may have to pay for it. They have the STI clinic. So there's, you know, looking and see what resources are available within your health department. They had a diabetes educator that would go out, like if somebody was a newly diagnosed diabetic that was discharged from the hospital, you know, they would go and do home visits just to make sure they knew how to use their glucometer, that they knew how to drop their insulin, give their insulin, that kind of thing. All right, so group 2. It is the difference between community-oriented and community-based nursing.
So we said community oriented nursing, it focuses on health. Nursing focuses on, what was our question? Somebody write it down.
Okay, so a public health nurse conducts a flu vaccine drive for at-risk populations. Is that community-based or is it community-oriented?
Community-oriented.
Community-oriented.
Say that again.
Community-oriented.
Community-oriented.
Okay, so what are 4 resources that you would consider recommending in a care plan for a public health nurse conducting a flu vaccine drive?
Okay, we
chose one. We didn't do both.
We did number 2. We thought we were
Yeah.
number 2.
Okay, that's fine. Go
we
ahead.
literally only did 2.
Okay.
Okay, do you want me to go and say our 4 resources? So we did like Meals on Wheels. We did like home health care, arranging like PT, and then what was our last one?
Transportation.
Yeah, and then like medication management.
Okay, so you did scenario 2, a home health nurse visits a patient with chronic illness to monitor their care and medication.
Yeah.
Okay. So all right, so the 4 resources for chronic illness monitoring, care, and medication. What are some concerns when we have patients with chronic illnesses? Doesn't matter what the chronic illness is. What are some current concerns that we have with patients that have chronic illnesses?
Non-compliance.
Non-compliance, okay.
Exacerbation of the disease.
Exacerbation, okay.
Ability to do their activities, their ADLs.
Okay.
To maintain independence at home.
Nutrition.
Say that last one.
Nutrition.
Nutrition. Why is nutrition so important?
Because if they don't have nutrition, they don't have the strength to
heal.
Energy to heal properly.
Right. So when we're sick and whether it's an acute or whether it's a chronic illness, that increases our basal metabolic rate, right? So our BMR is higher, which means that generally speaking, we have a higher nutritional content that is needed in order for our body to continue to fight in whatever the illness is, right? Awesome. Good job. What's medication management? I know everybody's taken pharmacology and there's good and bad things about pharmacology, okay? But medications, What are some of the issues that so somebody said non-compliance. Absolutely. What are some other issues with medications?
They can't
Medication.
afford them.
The cost.
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 Okay.
Mix
Not
up.
remembering if they've taken it.
Mm-hmm. Taking the medication, right? Can I get to the pharmacy to pick up my medication?
Transportation. Yeah.
Okay.
It's like a resources all around.
Right. Can I read the label?
Get the bottle open.
Can I get the bottle open? I learned something. Pharmacology is absolutely one of my favorite things in the whole wide world. I'm not even gonna lie. I love pharmacology. And I have, you go to how they put the child caps on the bottles when you pick them up. Did you know? And I did not know this. I don't think in all my years of being a nurse, because I just never paid attention. They're all coming with the child lock cap. Did you know that you can flip the cap over and make it a non-child?
No.
Yes.
Wow.
Right? Who
Mhm.
knew? I was I don't know what made me read the label one day and what? I was like totally amazed that you can just flip the lid over and it becomes non-child proof.
I didn't know that.
Right? We all learned something new. So there's that. Okay, good job. All right, who was group 3?
We had the Johnson family.
All right.
A little bit of background about the Johnson family. They live in a small rural community with limited access to health care. The family consists of 4 family members. Some social and environmental factors. The Johnson family has no health insurance and rely on the local clinic that offers sliding scales that's based on income. However, the clinic is over 15 miles away and not accessible to public transportation. The family live in standard housing, and due to financial situation, the family have to skip medical appointments, depend on over-the-counter remedies. Lisa, she experienced social isolation. James, he has poor hypertension management. Lisa is at risk for she's a caregiver, so she's getting burnt out. Michael, his asthma has worsened due to environmental triggers. So the whole family just faces nutritional deficiencies due to their reliance on inexpensive processed food, which could be exacerbating James's hypertension. Now, our questions is going to start with the care plan template. So Hannah has that.
So for the biological risks, I put his hypertension and his arthritis, which is James, the father. And then the son has asthma. So those are just a few of those things that are like running in the family that they're dealing with. Environmental risks, they have poor home conditions that are causing asthma exacerbations in the son. They also have a lack of transportation to get to and from their appointments, and also to get the daughter to and from school. So she's been skipping out on school. Behavioral, I talked about them not having health insurance, and they've been choosing over-the-counter methods instead of prescriptions because they can't afford the costs. And they also can't afford balanced nutrition, so they've been relying on food banks and things like that that don't always offer the best options. Social, it said she was going through social isolation and caregiver burnout. She was unable to seek support for her stress and her health issues. And then just to kind of sum everything up, their health status is influenced by these risks because multiple members of the family have some chronic health conditions that aren't getting any better due to the lack of resources in their personal lives and their communities. They've become isolated and have been dealing with not having heat or electricity, no means of transportation, no means to pay for prescriptions due to no health insurance, and a child with asthma that needs treatments and cannot get them. So the members of this family, their health is declining.
Okay.
So
Oh, go ahead.
I just have a question. So what are some resources do you think that might be available for them to help with maybe they're just their housing stuff?
They can probably, oh, go ahead, I'm sorry.
No, you're fine. I was gonna say like job and family services, like members of the
Mhm.
community, they have groups like outreach that they can go to, social workers and things like that. And the daughter, when she is able to go to school, if she would get in contact with her counselor, I'm sure that they could give her more resources as well.
The house is rented,
They can
right?
go to
Go ahead.
the housing authority, if they can get them involved to come and do an inspection to see if it's up to code and up to date and stuff, where the landlord will be forced to have to get those things fixed or kind of like buy them out to go somewhere else.
Yep. Yep.
All right, so group 4. The immunization and health screenings in a school with a diverse immigrant population. Who wants to speak?
Okay, I can start, I guess. So the school nurse works at an urban elementary school with a high percentage of immigrant children. Many of the students have not received adequate immunizations or regular health screenings due to barriers such as language, lack of health, limited access to health care, and financial constraints. The school is also seeing an increase in preventable communicable diseases due to illnesses. Okay, hold on. I gotta go to the. So for our primary prevention, our goal was to prevent communicable disease by ensuring students are properly sorry, I can't get it out. Immunized and have access to routine health screenings. The SMART goal would be by the end of the school year, 95% of students will have completed their recommended immunizations and 80% will have received a health screening. Does anybody else want to chime in? No? Okay. So interventions. Organize on-site immunization clinics. The school nurse will coordinate with local health care providers to bring immunization clinics to the school. These clinics will be scheduled during school hours to reduce barriers related to transportation and working parents. This will look like a mobile healthcare unit set up in the school, in the gym, like in the gym or classroom areas, with immunizations provided to students whose records indicate that they are not up to date. For the second one, we will distribute materials in multiple languages. And for the third one, we would incorporate health education in their classrooms. For secondary preventions, the goal would be to identify students who are at risk for illnesses or have already missed key immunizations or health screening. SMART goal would be within the next 3 months, 100% of the students who are missing immunizations or health screenings will be identified and referred for appropriate care. For interventions, we would develop a tracking system to monitor students. We would identify at-risk students and reach out to the families, and we would host family information sessions. For tertiary preventions, our goal would be manage and reduce complications in students with chronic or untreated health conditions. The SMART goal would be within 6 months, students who are identified with chronic conditions or untreated health issues will have a comprehensive health care plan to place with 80% achieving improved health outcomes. Interventions for that would be create personalized care plans, establish a health support team at the school, and provide support groups and counseling services. Collaboration and stakeholder involvement, school administrators, parents and guardians, community health providers, interpreters, or translation services. For an evaluation plan, the priority items to evaluate would be on-site vaccination clinics, tracking systems to immunizations and screenings, and health outcomes for students with chronic conditions. Am I missing something? Oh, the expected outcomes would be primary prevention to improve general student health, lower prevalence of avoidable communicable diseases, and higher vaccination rates. Second will be identification and follow-up for students who miss vaccinations or screenings, which lowers the risk of preventable illnesses and ensure early interventions. And third would be better health outcomes for children and long-term or untreated illnesses as a result of efficient care plans, management, and support services.
Okay, good job. So immunizations is a big part when we come in. And so, for example, your local health departments, when people immigrate into the country, they don't always know what resources are available to them, right? You come to a new country, you may not know what is what resources are available to you. So here, the health department are a great resource. They come in, they can do screening for some of those more communicable diseases like tuberculosis and things like that. They can also, get them food vouchers, housing vouchers, and other resources to help them, kind of get settled to a certain extent. Even as far as providing for those, those immunizations for the kids and other resources. School nurses, anybody want, so I'm going to ask this question, does anybody want to work pediatrics when they become a nurse? So kind of iffy, right? And so with pediatrics, and right, there's a variety of different opportunities for you, right? You can of course work in a hospital, you can work in clinics, you can work in the school system as school nurses. Anybody who's got kids, have you worked with your school nurses as far as, maybe some things that your children need within the school, whether it's they need to take medication while they're at school, if they have, like an IEP or something in place within the school. So school nurses, are really a great resource for these, for a lot, especially for your newer parents or your immigrants that are coming into the United States. Because they're almost like a direct line to the community, right? They they spend time with your kids. They know what, whether it's food banks within the area, whether it's a free clinic in the area, going to the health department to get their immunizations, helping them find primary care, and even, up to including some of maybe like translation services as well, for, the students, and their families. Because when we're working with groups like this, we have to remember the family is a whole unit, right? Not just the individual child, because what affects the child is going to affect the family as a whole, right? Not just, the child themselves. So I think that you guys did a really good job with I know it's always a lot of information in a short period of time. And I do need to let